Thanks so much, James. On behalf of the BC Transplant team, I'm just so pleased to be here to join you today. Thank you for each of you being a part of such an inspirational team, working across the full spectrum of care. And we really have strong partnerships, focusing on saving more lives and the best possible patient outcomes. I will share our current priorities and some of the most recent data on donation and transplantation, with a particular focus, of course, on kidney transplant outcomes. While our work spans all the solid organ groups, the majority of people waiting for transplant here in BC are kidney patients. And this keeps us so focused on getting to a point, and we hope one day, that no one will have to wait. It's our job as a program to find solutions to increase the availability of organs for transplant. So we focus on three key priorities: increase organ donation, reduce the number of patients who are waiting, and improve how we deliver the care to transplant recipients and also donor families. Of course, these goals go hand in hand, and if we increase organ donation, we also hope we're reducing the waiting time. At BC Transplant, we're working to increase donation through a framework that includes 5 pillars, and I'd like to go through those with you today. The first focus is on public awareness, understanding, and support for organ donation, which are so critical to the success of an organ donation system. We have a strong public awareness, education, and community relations program. We're able to offer a large number of outreach and educational opportunities through our close to 200 volunteers across the province. I have met many of our volunteers, and their lived experience has incredible impact. Our volunteers are transplant recipients. They're also living donors and donor family members who are so courageous. Their stories resonate with the public and drive people to action by registering their organ donation decision. In this year so far, we've offered 50 events, which is a record number for us in terms of community outreach events. We also have a very strong public awareness campaigns during the National Organ and Tissue Donation Awareness Week, or NOCDAW, that's a tongue twister, including the Light Up Green event earlier this year in conjunction and collaboration with the Kidney Foundation of BC. So thank you, the Kidney Foundation of BC. We see a huge amount of engagement and conversation through social media. I've included just 2 recent popular posts from our Facebook page. In July, we used this very impactful quote about organ donation, and we reached about 23,000 people and over 500 times. And we actually saw a bump or an increase in registrations. Our Facebook Live event of the 500th heart transplant celebration recently at St. Paul's in August, we reached about 12,000 people and had about 6,000 views. Of course, the most compelling recent example in the Humboldt tragedy in April, we received more than 5,000 online registrations in BC in just 1 week. The graph here shows the impact on registrations also in our neighboring province in Alberta and Ontario, as well as here in BC. Logan Boulay took action, and he made his wishes known to his family before this unfortunate tragedy. His legacy continues, and I would like to remind each of you here today that if you have not taken action yourselves, or if you know somebody in your family that hasn't made their wishes known, please take a moment and have that conversation with your family tonight, and also register today. It only takes a few minutes, and go to transplant.bc.ca, and also we have our booth outside. So I've talked about partnerships just in my opening remarks. We'd like to thank and acknowledge the staff of ICBC and Service BC who have been provided training and education and are able to address some questions from the public. So we're going to try our first poll question. So we're going to try our technology out. I've been reassured it's going to work. So the poll question is, with all of our partnerships that I just mentioned, as well as our public awareness activities, what has been the growth in the donor registrations since last year? So if you have not voted, please do so, and I'm sure it's going to appear on the screen. Okay, so if you chose C, you are correct. We have seen a 15, oh, okay, I'm giving away the answer. There we go. So 15% increase. If we could go back to my presentation, that would be great. So we have seen a 15% rise, and we're over 1.3 British Columbians who have registered their decision. And still, I have to say, to move that needle, it just seems like so much effort. So again, I'm putting in a plug for each of you today to have those conversations and register your decision. The second and third pillars, in order to have the highest organ donation performance, includes our organ donation experts and physician champions and strong partnerships with both our perioperative OR and critical care communities. This next slide is just illustrating over many years, more and more hospitals can offer organ donation. So shown here are sites where organ donation can be offered as an end-of-life quality option. More and more, we can offer donation after cardiocirculatory death, or DCD, and that's an option. And again, it all comes down to connections and partnerships, which we've built over time. So thank you to all of you working in our various health authorities, to you and your colleagues. We have a really solid network of system-wide donation specialists and in-hospital donation coordinators at BC Transplant, and they work collaboratively in partnership with ICU donation physicians and regional hospital-based critical care teams to support organ donation at the hospital level. And each of these hospitals do have donation committees, and these are interdisciplinary in nature and are well attended by ICU staff and physicians, the emergency department, and the operating room, where they're focused on looking at process improvement and trying to avoid any missed opportunities for donation. These are just some of our statistics in terms of the number of referrals. What I'm talking about here is each year we receive referrals 24/7 from many hospitals, numerous hospitals across BC. And we have our 24/7 dedicated organ donation and hospital development team who receive these referrals. Just over the last 2 years, we've seen a 40% increase in those hospital referrals. And so that's really significant. And I'm happy to share that we are sustaining this level in 2018, which is truly remarkable. And like Colleen said, I have to come up with new adjectives to describe our performance. We also take pride in ensuring we have national best practices and leading practices here locally in BC. We work with many partners in our neighboring provinces, but also the Canadian Blood Services, and we look to standardize our guidelines, identify these best practices, and apply them here locally. And the work that's taking place here in BC on the living kidney donation side is truly remarkable, and we are one of the leaders across Canada. So thank you to all of you here today for your exceptional support of that specific program. The fifth and final pillar, as I would say, is an expanded programming or advancing our capability to have more organs available to save more lives. That's really what we're here to do. So within donation and transplantation, we know that the science is always evolving, and we aim to develop and implement new programs and new technologies. And I'll just share a few. The Transplant First initiative, which all of you are familiar with, has been underway to improve the rate of preemptive kidney transplants. Also, organ donation after medical assistance in dying. Also, continuing to steadily add additional hospitals that have the capacity to offer donation after cardiocirculatory death, or DCD. We are currently in the developmental phase of a potential hepatitis C positive kidney organ donor program. And lastly, on the lung side, we are going to be implementing in 2019 the ex vivo lung perfusion technology, which will improve the function of lungs that would not have ordinarily been used. So these are all programs that have an impact in saving more lives through transplant. So we're going to continue to use these 5 pillars moving forward. Now, you're probably wondering how we compare across our provinces in Canada. So I'm pleased to share with you, I think most of you know this already, but through all of these initiatives, this is having an impact. And for the first time, BC had the highest rate of donation in Canada at 24.9. That is really translating into a remarkable achievement, and the average across Canada is 21.8. And you can see we just edged out Ontario. So we're going to continue to strive to be number 1. Also, of course, with our increase in donation comes an increase in transplants. So if we look at just over the last 4 years, we've seen a 41% increase, and that's great news for so many people waiting for a life-saving transplant. And if we look more specifically where we're at, we did 505 transplants in fiscal year last year. And in terms of the number of kidney transplants, we saw an 18% increase just from the previous year alone, and 331 kidney transplants. And yet, we have 538 people today waiting for a kidney transplant. And that's why we're really here today. We have to strive to move the needle and improve patient outcomes and decrease waiting times. But I am pleased to share that right now we're on track to at least match what we did last year. So thank you to all of you in this room. In terms of renal transplant patients followed in BC, this is truly amazing. So we have 3,387 renal transplant patients in BC who are receiving lifelong care across the province. And I think we should take pause and really join me in clapping and celebrating this achievement for the pre-post transplant staff. So thank you. It certainly won't be long before we meet another milestone of 4,000 or 5,000. In terms of the most recent stats, again, trends in donation and transplant with a focus on kidneys. As I mentioned, the donor rate is climbing overall, and the kidney donation trend line closely mirrors this, and we're at about 24.1 when we just look at kidneys alone in terms of donors per million. One of the reasons for the increase in donors and the donor rate is that there's been more DCD donors. This has led to more kidney transplants. Over the last 2 years, we've also had another variable, which all of you are familiar with, is an increase in donors as a result of the unfortunate and tragic opioid crisis. This slide, I believe we did share last year, and so this is really looking at the living donor trend line. We have stayed consistent, while the deceased donation has significantly increased. So it's the deceased donation that has been the driver behind the dramatic growth in the number of transplants. I think you've also seen this in the past, but I wanted to share some good news. So the waiting times are down for all blood groups. Now, this is in months on the left-hand side, so I will review this in terms of years. In 2010, the overall wait time was about 5.4 years. Last year, it was 2.8 years. For blood group O, waiting times have been halved since 2010. So in 2010, if you had an O blood group type, you would have to wait 6.5 years. In 2017, that's dropped to just over 3 years. And this has had a remarkable impact on the quality of life for both patients and a positive impact to families, and so satisfying as a healthcare team. Also good news, Most patients are being transplanted within that 5-year mark of being listed or activated. This has come down significantly. So if we look at the year 2000, 40% of the patients waitlisted were transplanted within 5 years, but 35% were still waiting after 5 years. Now, 73% of patients who were waitlisted in 2012 were transplanted within 5 years, with only 9% waiting after 5 years. However, as I explained to everyone, we still have so many patients who need a transplant, but more importantly, we have patients who die while are waitlisted. So we have to continue our work. On the HSP side, on the highly sensitized patients, they are also getting transplanted. We totally recognize it can be such a long and challenging wait for these patients, but donor kidneys for HSP patients do become available and are shared across the country. We had 17 patients receive HSP kidneys in 2017. I noted earlier that the living donor trend line has stayed consistent while deceased donation has significantly increased. However, we are still one of the leading provinces within the country, and Manitoba has edged us out. So we need to do a little bit better in the coming couple of years. The proportion of people waiting for more than 2 years for a living kidney transplant has actually dropped. It's decreased. And that's good news, and that there are more preemptive kidney transplants last year than ever before. Just over 50% of living kidney transplant in 2017 were preemptive. And so this graph is just really a distribution of the time from dialysis to the transplant among the living donor kidney transplants with their first kidney transplant. Also, if we look at patient survival and graft survival, that's also very good, with patients living longer and keeping their transplants longer than ever before. It is worth pointing out that when we look at these two graphs, it's clear that the outcomes for living kidney transplants are better than deceased donor transplants, which is why living donation, and particularly preemptive, is just so important. So we do encourage patients to consider living kidney transplants before they even go on dialysis, if this is possible. Okay, to wrap up, another poll question. So, which organ was the first ever transplanted in British Columbia in 1968? If you could take a moment. I'm not going to tell you the answer as quickly as last time. Well, still voting. If you chose A, kidney, you are correct. If I can go back to the presentation. So that's right. And just to finally end, I'm thrilled to let you know that last week, on October 24th, we celebrated 50 years since the first transplant here in British Columbia. And it took place at Vancouver General Hospital. It was a kidney transplant. And the man who received this tremendous gift of life got an additional 7 years of life. It's a wonderful, great achievement to have reached 50 years of donation and transplant in this province. We could not be here today if it weren't for you and your unique skills and abilities. We so look forward to all the initiatives that are going to propel us through the next 50 years. I hope you enjoy the great discussion and many sessions today and tomorrow. Thank you so much.